All right. So today our agenda is to discuss, or our learning objectives are to hear feedback on the new MBQIP quality report template, as well as receiving updates on a temporary timeline for MBQIP quarterly data reports, and where you get a reverse site visit logistics update. So we're a couple weeks away from the reverse site visit, which is now virtual. So Andy from TASC will provide some updates regarding the reverse site visit. From the TASC side, we have next week our virtual knowledge group webinar, which will focus on implicit bias and health equity. We have an implicit bias quiz that we'll be sending out just to start your brain thinking on implicit biases in healthcare and some of the topics that surround that. We did get a few responses from flex programs related to their activities related to health equity. If you do have any and you didn't get a chance to respond to that email, please do come to the virtual knowledge group webinar and participate in that conversation. It's a topic that I don't believe we've talked about or covered from TASC or at the center, and we're excited to. We will have Stratus Health helping facilitate that conversation. A couple new resources coming out: the Community Paramedicine Impact Reference Guide, as well as the EMS topic collection, will be released shortly. I have another one that I need to get from my computer somewhere. I lost it. 1 second. We are in the final stages of developing a tool to help rural providers understand which federal funding relief for COVID and COVID-19 is relevant to their organization type, and what types of costs the funding can be utilized to help with or utilized to spend on. There is a critical access hospital recognition certificate focused on care coordination that will be profiled in a rural route. And shortly, by the end of the month, just in time for the reverse site visit, we should have a summit report focused on post-acute care. And we facilitated a summit in May, and we're just in the final stages of buttoning that report up. So we should be able to provide that to you guys in time for the reverse site visit as well. Any other TASC updates, TASC members that I'm forgetting? All right, hearing none, if you guys have any questions, task@ruralcenter.org will reach us here at TASC. Tori, are you ready for Flex program updates?
Hi everyone, it's Tori from the Federal Office of Rural Health Policy. It's so great to see so many of you on the TASC 90 today. I want to start off by thanking you for submitting your Flex NCCs, either the regular way or through the request for information process. I am happy to report that all Flex programs have submitted their non-competing continuation progress reports, and we were blown away by what you all have done in the face of COVID-19 to both continue your Flex work and to move it forward as you adapt to what your hospitals and communities need. So I thank you, and F4HP thanks you for all of your efforts in that regard. Some of you may have already seen some of your notices of award come for year 2, which is starting on September 1st. Please know that your project officer will be reaching out soon within the month of August to schedule an NOA call with you to go over those notices of award and your plans for your year 2 year. The next big due date for the Flex program is October 30th, which is your PIM submission. And Caleb and I are going to be working on putting together a webinar to go over new PIMs. That'll probably be end of August, early September. So please keep an eye out for that upcoming webinar. And then, last but not least, I am very excited to see all of you at the reverse site visit in a couple weeks. We have a great agenda coming together, and I'm excited to engage with you all there. Thanks so much. Back to you, Caleb.
couldn't find my mouse. I had to turn my button off on my screen. Thank you, Tori. Any questions for Tori in the federal office?
Hey, Tori, this is Angie in North Dakota. Can you repeat what you said quickly about PIMS?
Yep, your PIMS report is good. That's the next real due date for the Flex program, and that'll be due on October 30th.
Okay, sure. Did you say something was new or different about PIMS?
We are going to have a new format in order to align with the FY19 areas, since we shifted areas for the new competitive cycle. So we'll have minor changes, and Caleb and I will be providing technical assistance on that.
Okay, great. All right, thank you. Great, Tori. Bye-bye.
Any other questions for Tori in the federal office? All right, Sarah Brinkman from Arcata, I see you there.
Here I am. Hi, everyone. I don't have a fun background. You just have my curtains. Or blinds, I guess. They're not even fancy curtains. They're just blinds. So I just have a few updates from the Arcata side of things. With the reverse site visit coming up, we just wanted to let you all know we are slated to provide an MBQIP 101 breakout session. Robin Carlson and I will be doing that, and other members from our team will be joining as well. We are going to prep it as a 101, but we'll be asking for participant feedback at the beginning of the session and really looking to kind of drive the discussion based on the desires of the audience. So if that's of interest to you, just wanted to let you know that we're open to kind of driving the direction of that 101 session based on what you all would like to discuss. We also, later in August, have a virtual knowledge group call that's coming up, and I'm going to post the registration information in chat in case you aren't registered for that already. That's our MBQIP VKG. We skipped our June VKG as a result of the conflict with the NRHA annual conference going virtual, and then the poolside chat that the FRHP team posted. So looking forward to reconnecting with you all there. As a reminder, you are the intended audience for that event, so please don't pass that registration information along to your hospitals. Those VKGs like this TASC 90 and the TASC VKGs are meant for you all and your subcontractors. We do intend on that call to be kind of piggybacking off of some of the content that will be covered today with regards to the data reports and some ideas for you all as we move forward and how to continue to work with your hospitals on quality improvement while we are working through the next steps in, with FRHP and the Flex monitoring team to get you those data reports. Our second episode of Quality Time Sharing Pie is slated to be distributed with MBQIP Monthly in August, so it'll be coming out in a couple of weeks. We focused this time on what the QI mentors learned at their facilities as a result of the COVID-19 pandemic. So not specifically around their COVID response and how they set up a COVID response, but more about the lessons learned and potential long-term implications of some of those lessons learned. So what are things that they had to adjust as a result of COVID-19 that they want to maintain going forward as it relates to their quality improvement work? So we're really excited about that and hope that you'll all watch for that. With regards to when we send out that announcement about Quality Time Sharing Pie being available and MBQIP Monthly, just a gentle reminder to everyone that when we send out MBQIP Monthly, we do it in a distribution email and we call out announcements within that email. And if you aren't able to turn that around in a timely fashion to get it off to your hospitals, just a reminder to read through that before you forward it along. We had a few hospitals that reached out, had just received the announcement about MBQIP Monthly and then reached out to Robin interested in her office hours calls, but the office hours call had already passed by the time they got the announcement. So just a reminder that we do try to put timely information in there for hospitals to be able to participate in those events as well. And then our final update is around the MBQIP performance scores. You should have all received those from FRHP towards the beginning of this month. There was a flurry of activity in the TASC Flex forum regarding how states are utilizing those and what types of resources they're interested in developing or asking us to develop to support use of those scores. So we hope that that conversation continues, and we encourage you to reach out to us if you have any technical assistance needs or requests or suggestions with relation to that data. And that's all I have for today, unless there's anyone else from the our KETA team, I know we're all on the line, so if anyone has anything, please feel free to jump in.
I'll also open it up to questions for Sarah and our KETA team. Thank you, Sarah. Hearing no questions, I will ask Megan Lahr from the Flex Monitoring team if she is here for updates.
Yeah, no problem. Hi, everyone. This is Megan from the Flex Monitoring team, and just a few updates from us today. So in the past month, we've released two new really exciting products. One is on the provision of mental health services by CA-based rural health clinics. And the other is on engaging critical access hospitals in addressing rural substance use. And so those are available on our website, so check those out. We are continuing to work on a couple of projects from our last project year on CA cohorts for quality improvement activities, and a few other things that we're wrapping up, and as well as our Flex Monitoring team website. And so that should be live within the next month. We're really excited about relaunching a new redesign. And then we just kicked off our new project year this month. And so we're looking forward to some of the projects that we're just starting up, including TASC financial performance, as well as assessing the strategic response to COVID-19 in cause. And for that project on COVID-19, we'll be reaching out to several state flex programs to help us with contacting their cause later this summer, probably in early August. So look out for those emails from us in a couple of weeks. And the last update is what we're talking about today, the Flex Monitoring team taking over the production of the quarterly MBQIP reports. And so there will obviously be a lot more on that during this call. And that's all I've got.
Great, thank you very much, Megan. Any questions for Megan and the Flex Monitoring team?
Yeah, one question in the chat is just restating the two reports that were just completed. So those are the provision of mental health services by CA-based rural health clinics. And the second is engaging critical access hospitals in addressing rural substance use.
Great. Thank you very much. All right, so we have a couple polling questions. Just like all of our other webinars, we want to make sure we're providing adequate and good education content. So please take a moment to complete the polling questions. And then we will get to Natalia from the federal office for MBQIP quarterly reports, updates, and discussion. I like the video feature with the backgrounds. I think we should do a follow Scott and Jill's examples and Tracy's as well, because that could be the lake, that is Arizona, and that could very well be Hawaii. Hey Scott, good to see you. Looks like our polling is completed. So we will get Natalia's slides and discussion materials up in just a second.
Caleb, I can share my screen.
Oh yeah, I think that was whenever you are ready, I think we're ready to go.
Okay. Okay, hopefully everyone can see this. Hi everyone, I'm here again to talk to you one more time. So thank you for joining us today. We have a few items to cover, so I divided the presentation into two parts. We will have plenty of time to really go over some questions, so all I ask is that you wait with your questions, either put them in the chat box or wait to ask until we have the time slated for those. And I made sure that you don't have to wait for too long. We will have a few instances in which you will be asked for input in the presentation. So the first part will cover a data overview and the discussion around the MBQIP reports. In the second part, I wanted to follow up real quick on the poolside chat and the next steps. So that's where we are. Before we get started though, I wanted to throw this in here because I wanted to level set and just let you know in terms of context, which I find very helpful at times. At the beginning of conceptualizing this new phase of updating the MBQIP reports, we actually did not know at all from our office where we were standing back in May. So just to let you know, a few months ago, it's been an amazing journey of seeing the evolution of this work and really how we could, go from a period of time where things were very, very unexpected. So it felt like very close to what this quote says, which is, we were just taking the first step in faith, trying to figure out how to problem solve around the issues that we encountered in not being able to move forward with a contract for Telligent, to now being able to present you with a fully baked approach to the MBQIP reports. So it's taking us some time, but I just wanted to assure you that we've been doing a lot of work behind the scenes to make sure that we get what you need at the timeliest time that we have possible here from the federal office. So with that, I'll start with the data overview and the discussion of the reports. And this comes from the update that Christy provided at the tail end of the poolside chat last time. And I know some of you were not able to attend. And just to bring you back to that discussion, we provided a brief update on changes to the MBQIP reports that we hope to expand upon during this webinar. So again, we would like to welcome the Flex monitoring team at the University of Minnesota, who have been extremely gracious and efficient in taking this work on for us. We are longstanding partners. They've been working with us for over 20 years. So we appreciate the level of depth that they bring to the program, but in understanding the context of the program, but also in working with many of you here. And just to let you know, Arkita will remain the point of contact for anything related to TA about these reports when they come out. The FMT reports will be similar to the quarterly reports that were produced by Telligent, but not exactly the same. So I will go over some of those key features and differences coming up, but just to let you know, they will include all of the basic elements that the Telligent reports had. So that includes national, state, and cat-level data. We have a three-phased approach for producing those reports. And again, I will go over very detailed timelines of each of those phases. As FMT relaunches the process, we definitely expect to have a few changes that I'm hoping you understand, given the change in from Telligent to the University of Minnesota. So just to start, I wanted to provide you some understanding of what happens to the data from the time that the hospitals report the data to the time that we receive the data. And so in this first graphic, you will see just an overlay of the different mechanisms for collection of data and reporting that data that goes through on the left panel, that's label number 1 through QualityNet. So you have those measures there that are submitted by either a vendor or a card tool directly to QualityNet. And then it goes through a process of collection by CMS, in which they will, analyze the data, and the data goes to a large data warehouse. So they have their own contractors in place that will take care of that piece. And then moving on to the right, we have another partner that comes into play. The CDC administers the National Health Survey. The NHSN survey. And we have a couple of measures there that go through that process. And then finally, on the rightmost side, you can, I don't know if you can see everything on my screen, but that was covering it. We have the State Flex office, that is another reporting channel for the EDTC measure. So as you can see here, all of the measures for the most part, except for EDTC, are really out of our purview, and really we depend on other processes that are already implemented and in place to get the data. So going on to the next slide, I'll show you how that then translates into a timeline from the reporting to the distribution of the data reports to all of the states. So we have the hospitals collecting the data within an encounter period. They submit it by a deadline, and then the data is sent to either CMS, CDC, or the state flex coordinators, the previous slide there that I touched upon. And then at that point, the FMT team and our office receives and validates the data. And they move forward to developing the reports, and then they send us those reports to double check for quality. And then at that point, we distribute the reports to the state flex coordinators. So it is quite a journey from the moment that the data is submitted by a hospital all the way to it being reflected in a report. And I just wanted to help you to kind of understand that evolution of what happens to that data. I know a lot of you are familiar with this, but I think it helps to kind of remind ourselves where we started and where we are now with this process. So with that comes a few questions that people have raised in terms of data lags, and they do vary by report. So we have a large range in some cases, and that is because we have a little bit more control of the EDTC measure and what happens in that process than we do of the other measure areas. So we have an encounter period is usually from 1 month to even 4 months, given the other measures. And then it goes to the hospital submission deadline. So it's the same timeline that I showed in the previous slide, and just gives you a little bit of an idea of what happens in the lag in between. So that on top is a total lag of 6 weeks to 8 months already, given the amount of time that it takes to go through all of these channels. So by the time we get the data, it's already with a little bit of a lag that we really have minimal control over. So we have, at that point, a little bit more control of what happens in the process. So we share the data with FMT. That takes about 3 weeks to produce the reports. The reports get sent to us. We take about 2 weeks to then have the data completely distributed across all 45 states. So that is usually around 5 weeks time. So I hope this is helpful for everyone, but I'll be happy to answer any questions a little bit later. So what to expect on the reports? We have 5 different types of reports that will be produced by FMT. We have a patient experience report that will have the HCAHPS measures, 11 in total. We have the care transitions report that will have the EDTC data with the new measure that has a total of 9 measures. Then we move into the patient safety, inpatient and outpatient report. And then you can see a total of measures that go in there. And we have an additional report there for healthcare acquired infection data. And then finally, we have an annual report that I'll discuss later. In terms of the quarterly report contents, we will have now a cover page. This is a little bit different. It contains a non-technical introduction to how the report was created and a description of how to interpret the results. And this really came from conversations with different states, just understanding that how the reports are handled sometimes, and depending on the level of capacity at the state office, it might be helpful to have a way of explaining what's in the report, how you can use the report to inform your stakeholders, and how to interpret those results. So that is really to, just understanding that there is a wide variety of capacity levels at the state office. We wanted to have another feature that is a little bit more helpful than the way that the intelligent reports were created. Then we have the data for the most recent report period, for the most recent reporting period and the previous periods. So you will see all of the different values were relevant, and then those will be for the state and national data for each of the measures. So going into the phases and what happens in each, and a little bit of time frames that I think everyone is anxious to know. For phase 1, we started in late May. Again, going back to the quote that I gave you in the beginning, that was in early May, we were just taking a step, totally blind to the rest of the staircase, not knowing if we were going to fall down. So I think given that now we can call these phases and see a little bit more of the stairwell is something that makes me really relieved, and I hope it creates the same sense of relief for you. So the internal negotiations began with FMT at that time, and we've started discussions with our federal partners as well. Again, there's a lot of behind the scenes work that I want to commend our director for being so supportive. Christy has been really involved in all of those processes, just making sure that we move forward as fast as we can. Then at that point, we also had conversations with FMT to develop and set up the production of the initial set of quarterly reports and discuss what those timelines would look like, what the reports would look like, and all of the different components. In phase 2 is the phase that we're currently in at the same time as phase 1 in a way, because in phase 1, we're still negotiating pieces of what the report content will be like, and then in phase 2 we're really moving into a rapid learning cycle phase with opportunities to integrate feedback from the state flex coordinators, and then moving into a process of development production for the quarterly reports. Then at that a feature of phase 2 is that we will release a consistent report delivery schedule by early 2021. So that means that the time lag that you see from the last quarter to this quarter is really temporary. It will only happen in the meantime while we get set up. And then in phase 2, we will launch a process that is more in line with what you were used to receiving in the past. At that point, we will also have, at the end of that phase, we will have a 2019 annual report that FMT will produce for that year. And then we'll move right into phase 3 in the fall of 2021. And that phase is really characterized by the release of the 2020 annual report that will have the different data elements that we have asked them to produce, development of new benchmarks for each of the measures that will be done in collaboration with a group of experts. So for the first time, we'll be really looking at developing benchmarks at the state level. And I'm really excited about that piece. FMT will have a process we'll be working really hard from the beginning to the fall of 2021 to make sure that we have the right approach to development of those benchmarks. And then we will have an exploratory implementation of the MBQIP performance score. And what that means is the current data that you just recently saw with the performance score, we will be addressing internally in partnership with FMT and Arquita, how we can integrate that data into the quarterly reports at that point. Given that in this period of time, we're still in the process of COVID-19, figuring out what that reporting looks like from the states, and also making sure that all of those items combined don't have an artificial effect on the score. And if they do, how do we deal with that in a way that is prospectively looking at solutions? So that's basically the description of all 3 phases at a high level. And then I'll go into more detail in the coming slides. So for the first phase, which we're still right now going through this phase, it started in late May and it will continue through the fall, I would say early fall 2020. I'm sorry, I just misspoke. It will be from the late summer to the end of the fall of 2020. So this is a temporary, again, or catch-up timeline to deliver the initial set of MBQIP reports. And we hope to have this transition period where we can still, provide you the data, but also understand if there are other needs that need to be met in your states and work with you individually to make sure that those are addressed. We understand there's a range in utility for those reports right now, with some states really being caught in the middle of the COVID-19 battle, and other states are sort of more focused or refocused on quality improvement. So we really want to partner with you to understand how we can best help. And so again, the intent is to transition to a consistent quarterly report delivery schedule in phase 2. So the first data that you will receive is a spreadsheet on August 20th. It will be the antibiotic stewardship data, understanding that could perhaps help you set your plans around the antibiotic stewardship measures, since that report will not come until later on. And then in September 28th, we will have 2 reports for EDTC for Q1 2020 and Q2. In November, we will have the patient safety and inpatient outpatient report for 2 quarters as well. Again, it's a catch-up period, so you'll see that's why we will release 2 reports at once. And then finally, you'll have your HCAPS report. And this date, I just want to say, we're still under negotiation with CMS for the data on HCAPS. That seems to be a little bit more complicated than we thought. So we will be addressing those items along with our federal partners and FMT. And perhaps it will change slightly, but I don't expect it to be a significant change. So in this transition, we just, again, want to understand how can we help, and to tell you that we want to align as much as possible with previous processes, but understanding that we had this changes. Sometimes it actually, the fact that we had change created opportunities for expanding on those changes and building upon those changes to make it better. So I'm really hoping that some of the features of those reports moving forward would be an improvement of the intelligent reports that you were getting previously. So with that, I want to, get you thinking about this couple of questions, which is, what can we do to help you? And one potential item that we brought up at the last session when we last met during the poolside chat was, this idea of a statement from our office to the hospitals to alleviate burden. And I know that I've already gotten a few requests for this that, we're hoping to do as systematically as possible so that we understand what the need is across and we can best find a way to meet those needs. And then finally, we also have our Akita team available for consultations during this phase. The tools that you may need and resource development, please let them know how we can assist hospitals in the transition or what would be helpful in terms of those resources and tools. And then here, I just want to pause for questions to see, what you may want, what you have in your mind regarding this process for phase 1 before we go into phase 2.
Natalia, this is Scott. Yeah, the statement from FRHP will be really helpful, but I need it not just for hospitals. We're in the process of developing a sort of pay for performance plan within the state through the Medicaid office. So it'd be helpful to have something for them too, to show why I don't have the numbers on time anymore, or for the short period. So.
Sure, that's a great point, Scott. Thank you, point taken. Okay, so if you can think of any other questions, we'll definitely come back to those, but we'll move forward to phase 2. So this will be late summer through the summer of 2021. In this phase, I'm sorry that I keep moving this back and forth. I'm sure it's driving people crazy a little bit, but I apologize. In this phase, we really will have a rapid cycle learning phase, truly. So we'll start with learning what are those changes that we need to implement, applying those changes in collaboration with our partners, with FMT or KITA, and then implementing those changes into the reports. So the idea is by the time that we release the consistent schedule of reporting, that we will have integrated all of the feedback, that we have a template for those reports that you can expect in a quarterly basis moving forward. But we really want to take the opportunity to apply and optimize those learnings before those reports are created and the new process is fully implemented. So it's really a full year of learning. And you know, I'd like to call this rapid cycle learning because it really has felt that's been the case since the beginning. And I'd like to continue with that approach moving forward. I think it's really important that we have end user feedback to understand what are those issues that you come up with, and if there is a way that we can address it or make it more simple for everyone, we will definitely take that feedback and really think through it with our partners. So again, we'll hope to reach an understanding of what are the limitations through a scan of our resources, and then what are those end user needs to help us close the gap in what we do and what we know and what we do. So this will inform the prototyping changes that are intended to really prepare us for launching that consistent schedule in early 2021, and also the annual report. So going over the timeline here, so this looks a little bit different from what you saw with Telligent, but this is the best we could do under the circumstances and the changes. We have each of the reports names listed here, so I hope that you can reference this table moving forward. I'll also ask our task partners to release this on their website to replace the current schedule that is posted online. So this will definitely be a reference point for all of you that you'll have available. And it just shows you an overview of those timeframes with each of the quarterly reports. So going back to the rapid cycle learning. Again, we have this timeline here, but we're hoping that by the time that we get here in 2021, we will have gone through a series of cycles, learning cycles that would be completed in phase 2. So the way that we really would like to do this is with your support and your feedback. And I wanted to take just a moment to thank everyone who participated in the fielded survey, because that was actually rapid cycle learning. And we had a very quick survey, a couple of minutes to really let us understand a little bit more about how do you use those reports. And that really helped us drive some conversations internally. So I just wanted to kind of go back to the feature of this phase, which is really the rapid cycle learning, and let you know that the survey results were actually fully integrated into the presentation today. So this was something that we really enjoyed to see. The variability in responses and your input, all of it was super valuable. This is how we distilled that information. So at a high level, we had folks that told us, you know, they really liked the format of having the 90th percentile data, the state and national averages. They didn't like the timeliness of the reports or having 3 separate reports. So this is something that we're hoping to address in today's presentation by explaining that transition between when the hospitals submit the data all the way to when we provide the data, so that you can see what happens there and why we have that lag. And the better we can do in the future I think will be definitely something that we look forward to doing in partnership with our other federal partners. But at this point, this is the transparent timeline that we have to present, understanding that is not ideal with the timelines that we have, with some of those reports having as much as 8 months. But this is, you know, something that we have to deal with. And what I can say is we would really like to understand, for the states that find this very, very much of an issue for the hospitals, you know, what are other ways that we can help your hospitals use that data? So if you find it that is the timeliness of having an HCAHPS report a year later, we really want to understand what are some other things that we can do based on either current QI activities that they have going on or that they can plan. We want to understand the full spectrum of needs, and you know, this is really something that we hope to integrate, not necessarily only through the reports, but also broadly at a programmatic level through MBQIP. So we will have still 3 separate reports, and we understand a lot of folks don't like that, but actually that idea was done so that we can have more timeliness of the data, given that each of those data pieces come at a different time. In terms of the PDF format, some people prefer a spreadsheet, so I think we can definitely adapt those changes and make sure that we cater to both preferences. And then a lot of you said we don't have a visual representation over time, and that is definitely something that we have negotiated for the annual report, to have that visual representation over time that we think will be very helpful for people. In terms of the data, you all said that the state and national averages were something that you like to see, the 90th percentile again, the inclusion of data from previous quarters, and that is something that we're also integrating and have already had that agreement with FMT, and in terms of how we can develop those benchmarks that are different. So we're really looking back to at least 3 quarters of data to come up with those benchmarks, and we're doing it in a evidence-based kind of way, like pulling from a group of experts. So this will take some time, but we will get there. This slides were the timeliness of the data, and again, we really like to know more nuance around that and see how we can help. And I'm sure that once we discuss fully the results of the poolside chat, we'll be able to address that topic at a deeper level. And then finally, the use of the reports. We had a lot of themes going on around the use of the reports, and the top 6 were portrayed here in this slide, which is, you know, sending those reports to the hospitals, doing your own data analysis, the use for the benchmarks, and the use for prioritizing the projects and to plan site visits. And some of you said the reports are not useful, and that is also valuable information. We want to understand, you know, what can be useful and how we can, you know, help you meet that need, understanding that these reports are not one size fits all. So these were some of the key recommendations that we got from the survey. And again, I just wanted to put that graphic on the right to show you the progression through that rapid learning cycle. And we started really with the survey to learn from you what you thought was useful or not useful, and then apply those with conversations with our partner FMT to really understand how we can apply what we learned, and then implement those in the report production phase. So a lot of you have made several requests, and those were, I hope that we have accomplished those by this webinar. And for you to know that the next time we go through that cycle, it begins today, really, with your input. So I'm very committed to doing this approach of integrating your feedback, listening to your needs, and making changes, and just asking you that you're patient with those changes. We understand that it takes a lot of your time to really provide that input, and a lot of faith, really, and not really seeing fully that staircase, but sometimes, you know, being on the bottom and not understanding where it would lead. I really appreciate everyone's candid feedback around the various MBQIP items that you have shared with me in various occasions through the chat, through individual calls. And again, to reiterate my commitment to making sure that you're heard and that you can see how we've implemented your feedback along the way. So these are some short-term opportunities for providing feedback to us and for more rapid cycle learning in phase 2. So again, it will be looking at the responses from the 2 questions that we will be addressing today in just a couple of minutes. The feedback that you provide to those questions would really help us inform discussions with FMT that are needed in order to wrap up the planning for those report timelines. And also, if you don't feel like it's something that you're comfortable sharing during this webinar, feel free to email us as well. Know that we will be definitely looking at everything closely to make sure that is addressed with FMT as we're in this stage of report production. Then in October of this year, in the fall, we'll have a little bit of a different approach. I'll do an open office hours with me, and it will be at a point of coming together to really understand how you feel about the first set of reports that were released around September. So you will have the data at that point, and I would really want to hear from all of you, you know, what this experience was like and how we can make improvements at that point. It would really be another opportunity for our office to engage with all of you and make sure that we're integrating your feedback. And then we'll share those learnings with FMT and Arkita, and hopefully it can inform a lot of other resources that can be available to all of you as you begin to address and work on the reports with your hospitals in the state. So then in January of 2021, we'll have a fireside chat this time to check in with the state flex coordinators, just to allow for that active discussion again of understanding, you know, how you're using the reports. And the thing about understanding really how the reports are used is simply because it leads us to question more about the opportunities for quality improvement and how we can support those quality improvement activities. So with us having very short time to really produce those reports and kind of address all of those changes, especially when it comes to measures and the difficulties in making shifts in those measures, we want to make sure that we listen to you in terms of what are the needs broadly for quality improvement to see if we can move the needle there more rapidly. So we'll have a wrap up of this rapid cycle learning phase before we're back on the delivery schedule. And that's sort of the agenda for what that looks like. So with that, I wanted to just pause here and ask you a couple of questions regarding, you know, what would be helpful for states now or after the reports come out. And this could be a variety of things, from resources, tools, communication points, anything that you find helpful. And then what would be helpful for your hospitals? What do you think the leadership at the hospital would like in order to get, you know, buy-in from them to be able to continue reporting, and how we can help them in the transition? We understand that this process of change may affect morale at the hospital level, and we want to make sure that we mitigate that as much as possible. So really understanding what we can do from our end to help you there would be really helpful. So if anyone wants to jump in at this point, I'll open the floor for questions or comments.
Natalia, this is Christy with the federal office. Just looking at the chat box, and there's a few comments about the timeliness of reports and how it seems to be more with just having a consistent schedule, and when meetings are planned around the data and then the data reports are delayed, it impacts those discussions from happening. Or using the reports to tie into the SHIP payments is important for the timeliness as well.
Sure. And I also want to encourage FMT or Akita if you want to chime in with any additional points that might be helpful to understand from states. Okay, Caleb, how are we doing with time?
We are good. We have just a little over a half an hour, and the reverse site visit update shouldn't take too long.
Okay, great.
So we've got plenty of time.
I see that there is a movement on the chat box.
So Natalia, this is Carla. I think I can try to address some of the chat box questions, and
Sure.
please, Megan and Robin and Sarah and others, please chime in. Marie asks about critical access hospitals getting their data from QualityNet. So the hospitals will have their own data. They can actually pull their results. If they're using CART, they can pull it from that, or if they're using a vendor, their vendor should be able to provide that to them. I'm not aware that anybody other than CMS can actually pull data back out of QualityNet. So I think the challenge there is the hospitals can get their own data, but then if you want to compile it as a flex coordinator, there would need to be another process for that to come together in a sooner timeline, if that makes sense. And then the raw data, I just want to comment because I know there's been a lot of confusion about this over the years of what we mean by raw data. So what ends up being available is the data that populates the reports in an Excel-based format. What's not available, and I don't think is going to be available, is that true raw data, which is the patient level files that get submitted to QualityNet. So you will be getting the Excel files, but you won't be able to get the true raw data, which means the actual patient level data that gets submitted into QualityNet. So I just know that that has created some confusion in the past, so wanted to clarify that.
Thanks, Carla. Okay, maybe just one more minute to allow folks to jump in with questions or any other comments from Arkita or FMT. Feel free to jump in.
There are a few additional questions in the chat box that I want to make sure we at least capture. And I think there's an opportunity here for TASC or someone, as long as we can save this chat, to collect all these and just make sure they are answered kind of one by one, either in the Flex forum or an email, something like that, because there's a lot of discussion in the chat feature, and we want to make sure we're answering all this stuff, even if we can't maintain all of it as we're going. So I just wanted to make sure.
Yeah, and thank you for making that point, Caleb. I should have mentioned that for sure. We know that we expect a variety of different requests, and the idea is to definitely do that connection with each individual if it warrants that, or we can do a broad communication if a lot of people are having the same question. So, you know, again, given the format of today's webinar, I wanted to provide this opportunity, understanding that our time here for discussion is limited, but that does not mean that we will not cover any suggestion or question that comes through. We're hoping to make sure that we capture all of that, and we'll definitely save those questions and to get back to everyone.
Natalia, this is Sarah. There's some questions about the method of delivery and if that's still going to go to the state flex coordinators, and then they'll be responsible for distribution to the hospitals. So if you could speak to that, I think that would be helpful.
yes, the reports will go back to the state flex coordinators, and they will still be the point of contact for for their hospitals. So the intent is definitely to continue to use that approach.
And then how will they get the data? The state flex programs.
The state flex programs will get the data through the PO. So in this period of time where we at the federal office have been short-staffed with only 2 POs, I've been the one distributing the data. For the future, in coming up with those reports that are due, we are expecting to have a team of 4 POs again. So we will divide the states by those 4 POs, and so your PO at the time will be the point of contact for your data.
That's helpful. I think that's more about the mechanism. So is it through like the NIH? Is it through the portal? Is it email? What's the mechanism?
Yes, so it is right now, it is through the NIH portal. So we will have, we've just started actually carving out a process with FMT on how to make sure that that is set up in a way that is easily accessible to folks. Again, prototyping on the rapid cycle learning phase right now with the NIH system. I have a couple of you that I have been dealing with and had to get personally involved with the NIH in her some IT help desks to make sure that access issues are resolved. So I am hoping that we, in learning all of the difficulties that have stemmed from a variety of issues, ranging from firewall issues to the account being disabled for the main user, to data disappearing on a workspace because it's only there for a period of time. All of those issues I'm just, learning about. So I think it has been extremely helpful to work in partnership with each of you, and I appreciate your patience. However, the system still works broadly for the majority. So while I'm trying to address those nuanced challenges that have come up, and we're still having an issue with 2 people having access to data, we're hoping that those will resolve by the time that we have data distribution coming up in the fall. So that's the intent. Once we know a process that is more clear and I can feel confident that it will be the least possible way that we'll have emerging issues such as the ones we've been having, I will let you know. Definitely that is a potential change as well. I just don't want to send you in a different rabbit hole if we don't have the consistent approach right now. But for now, for the most part, those issues have been resolved. Any other questions that you guys want me to address now? I see the chat thing popping up on my screen, but I'm afraid to click it, and then my presentation going away.
That's all right. It's no worry. Like we said, we will make sure to sift through all these things and maybe send them over to Natalia or Arkita, and probably a group text or email. That way everything gets an answer, and we can, like I said, either put it in the forum, a flex email, something like that. That way you guys have access to this. There's some pretty specific questions in here that we want to make sure we have answers to. And then to Natalia's point, there's some big stuff in here that we could work on from the federal office or flex monitoring teams or side or TASC side. I saw some discussions for crosswalks and things like that. I think those are great ideas and suggestions. So we don't want to lose any of this just because we missed one chat box or chat during the presentation. So thank you guys for putting all this in here. And as always, if you did have a question that we don't get to on the webinar or in an email, please don't hesitate to reach out to task@ruralcenter.org, your project officer, Arkita, or Flex Monitoring team as well. Someone will have the answer or will find it.
Thank you, and I promise I'll pull in some help from someone that is more high tech than me to make sure that chat is saved and we capture everything.
Yeah. Any other questions before we move on?
Caleb, this is Sally. As
Hey, Sally.
someone asked about the slides, and Andy has posted those in the chat box that you can click on it and download it. It will, of course, come out with the recording, but if somebody's wanting to look at the slides in reference to some of the questions right away,
Thank you.
can click on the red chat bubble down there and get the
And
slides.
if it helps, I can also send the slides via email after this, just to make sure everyone has them.
Great, guys. Then thank you,
So-
Sal, for mentioning that.
So I think I'll move forward just because I want to cover a little bit of time on phase 3 and then move into the last part of our discussion, which is a follow-up to the poolside chat. So for phase 3, this is really now looking forward to 2021, the annual report. So we'll have two annual reports, just to be clear. So in 2021, FMT will produce 2 new reports. This will be interim annual report that will be based on 2019 data that is to be released in the spring of 2021. And then we'll have a 2020 annual report that will be released in the fall of 2021. So this was, again, it's something that I think formed from the ideas that I received based on what states said would be helpful to capture data from all of the measures in the quarterly reports in one succinct report at the end of the year. So it will have state and national level data. And I'm hoping that this would be really helpful for everyone. So the report will have data for each of the states in comparison to the previous year. So you will have a summary analysis for each of the measures and trends. This is a new feature I'm really excited about, and ways to visualize the data. And we'll have the benchmarks for each of the measures that will be developed in the first year. So now, if you have any last questions on the reports themselves, now that I've covered pretty much everything, including the annual report. Just wanted to make sure that before we switch gears, anything that you want me to talk to during this conversation that we have. And Caleb, do you mind being the navigator of those questions? That would be much appreciated.
Absolutely. Yeah, we'll get that figured out. Diana, I seem to have sound. Seems like at least one person lost some sound.
Okay. Any other questions related to the reports before we move on to a different topic? Well, thank you, everyone. I think I was expecting eggs and tomatoes and things thrown at me. So thank you for your patience with this. So on this second part of the webinar, we'll do a quick follow-up on the poolside chat. And, you know, for those who were not able to attend, I think a couple of you have emailed me and I've said, you know, open the opportunity to send that feedback through email. I'm still working on getting the recording enabled with our IT. So Christy has been also involved in helping us get that relaunched. So as soon as I have that recording link updated, because it seems to have been a little bit of an issue in terms of external users out of HRSA accessing that recording, I will share it by email. So where we are now, though, is in this process again of getting your feedback. So the last time was really a great opportunity to kind of get to see the richness of your perspectives all in one compressed hour. And that was really amazing to see, just the energy, that the collaboration, how different ideas built from one another. That was incredibly rich in my opinion, and it's something that I'd like to continue to do in the future. So you will see that I'll have more of this poolside chat style conversations in the future. So we will have, again, is just to kind of let you know the process overall. We'll continue to ask you to be our partners that truly inform our work. And then we will have opportunities for this strategic planning and using this, what I call the pull push approach, which is really pulling from the bottom, which is, you know, from all of you who are part of this program, and then pushing information out to at a national level based on what we hear. So I have on the right just created a little visual to kind of let you know what happens with that feedback. So it comes to the federal office, and then I'll primarily handle that feedback in collaboration with our leadership and our division. And then it will be shared with our partners as well. And then we will seek guidance from them to really understand how we can turn that input into either further policies or guidance from our office, or products that may be helpful in addressing what we hear. So that's sort of what the overall process looks like. You will see that the poolside chat launched the MBQIP strategic planning approach, right? So now we're really looking for continuing this energy moving forward. And I just wanted to make sure that I take an opportunity to share what we're doing. So some of our primary aims in this process are to use what you tell us as evidence to make our decisions on different parts of the program. And so I hope that this resonates with people here. I really want to make sure that you understand that the time that you put into giving us that feedback is valued, and we understand that, you know, it's important for you to see what happens next. So this is a brief timeline that I developed based on where we are now. So we had, for the MBQIP refresh, we started again in August of 2019 with an internal meeting to really dissect and understand broadly what are the main issues. So we came up with 3 main action areas from that meeting. The strategic planning that we began in late 2019 with Arkita was really centered around all of that feedback that came from the previous year, and efforts from my predecessor, Yvonne, to really understand as well how to, you know, make timely changes to the program in areas that are relevant to all of the states. And then we moved into internal discussions that was at times with federal partners. We have been in close collaboration lately with CMS and also our CDC counterparts. And then we launched the poolside chat with the state flex coordinators. At that point, again, we really were hoping to see the level of engagement that you all provided. So that was great. And now in this webinar, I wanted to begin to present you with some of those results. And really that will be what sets our strategic planning forward. So we will have another check-in around October, like I mentioned, but also a more formal one in January of 2021. And at that point, it'll be, like I said previously, a fireside chat to really, you know, talk through some of those changes that were implemented along the way. What did we learn from all of the rapid cycle learnings that we implemented, and, you know, how to craft the next round. So we'll do a strategic plan based on all of that. And then I'm hoping to share that strategic plan sometime in the spring. And then, I'm sorry, not in the spring, in May 2021, we'll have the second bullseye chat, which, you know, will kind of offer you a broader perspective on what we think makes sense from strategic planning based on the input that we received along the way. So with the analysis, I just wanted to let you know what happened after you typed in furiously in those chat boxes last time. It was great to see that movement, by the way. So we analyzed responses using, like I just call it qualitative attitudinal data. And it is really qualitative data that you're providing live. So that was very helpful. I don't think we would have been able to reach that level of input even if we had it in person. So I really thank everyone for your participation and for not being shy about sharing your opinions, even if those opinions were sometimes difficult things that we just, you know, we have to figure out. We developed a deductive thematic approach organized by the 3 questions. So the reason why it's deductive is because we already had those 3 questions that we put on those chatbots. We organized themes based on that structure. So the thematic structure was evaluated for good fit to develop the key findings. And the graphic on the right just shows you sort of like the cycle of what happens when we have qualitative data. We go through that data collection, which happened through the bullseye chat. We go through a period of data reduction, which is, you know, how do we compress themes? And then how do we display that data so that it makes sense? And then we draw conclusions from drawing or verifying data. So at that point in time is when the product will be fully done. And at that time, I'm happy to share with everyone. And I just have this here because perspective matters. So I think, you know, just to show you, like, in terms of the process of evaluating and analyzing those results, it's really tricky in terms of making sure that we capture perspectives and we make sense of your perspectives, and we are, you know, understanding what that perspective is in one state versus another state that may see it another way, and what does that say about the concept. So really that's where the richness of the qualitative data come together to really allow us to make those connections. So I like that cartoon because it really exemplifies that perspective matters in what we do for qualitative analysis. So the preliminary results, I wanted to just give you an idea today. Again, it's not fully formed yet, and you will get a final report that I will share in the fall with everything that came through. I'm sure people would really appreciate kind of understanding where their contribution lies, what piece of the puzzle you contributed to, and like looking at it all together, it would be a really great opportunity. So we'll have themes organized around the questions that guided the bullseye discussion. And so this is what happened in the preliminary phase of the analysis. I have about 12 themes that really conceptualize or form part of question 1, which was around challenges in the states for meeting MBQIP participation and reporting. These are there were some surprising things, others not so surprising, but the context that you provided and the way that you mentioned things really helped us connect the dots. So I appreciate that. And I think that will show in the thematic structure that we developed at the end. For the measured topic areas are most relevant to the critical access hospitals, we have 10 sub-themes that we identified. And then finally, for the priorities, another 10 themes. So again, it's a lot of rich data, but it's going back to this graphic on the right. We collected data, we reduced the data. It's almost like it's qualitative data, but you have to quantify. Welcome to Qualitative Analysis 101. You quantify the results. So that's where we are now. And I will just show you today a sample of what those themes look like in terms of, you know, the most popular themes for the first question, which was around challenges for MBQIP participation. So we heard that a lot of the QI staff in the critical access hospitals were overburdened, and they have competing priorities. They have, there's challenges with staff turnover in the critical access hospitals. And because of that, I mean, I think one thing that I actually learned was that is the difference from, you know, administering a survey versus collecting this qualitative data, right? So we could have asked you this through a survey and you say staff turnover in critical access hospitals. That doesn't really tell us much. But then with the richness of the qualitative input that we received, it was clear that there was need for targeting trainings that were specifically for that critical access hospital staff on MBQIP, that also targeted the C-suite or leadership to increase the support. That was correlated with that theme on the bottom about leadership support. We also had a lot of input around the meaningfulness or relevance of the measures in MBQIP for QI. So that was really interesting as well, because I think it just validated the perspective that I kind of brought in the beginning, which was, let's focus on the QI piece and really transition to look at the work that we do in MBQIP from a QI lens. Given that there are there is minimal space to move around in the measures world, this is one area that I think, you know, as you all confirmed, people are saying that the measures sometimes are topped out in different states. So what do you do at that point? Because if you don't use those reports, you don't use that measure, it is not a bad thing. It's great that you're all, some states, I should say, are reaching that 100% performance on that measure. But what do we do then? How do we then turn that measure area into an actionable area for QI? So that's really where that leads us. And then finally, the reporting burden or the need for streamlined reporting is definitely another actionable area that we can look more deeply into. So this is just to give you a little bit of a flavor of what those preliminary results would look like. So in the report will have a lot more richness around those results and what those themes look like. So I want to go back to the graphic that I showed earlier, except this time I want to show you again. I think visuals sometimes help, just how we can do this pull-push approach. So really starting with the pull-side chat, you'll see the red circles are really opportunities for all of the state flex coordinators to provide that input. So we're pulling from you at those instances. So you'll see that very consistently we'll be doing that moving forward. Then the little star there means that we will have that qualitative report ready to reflect on all of the input that you were able to provide. So again, something actionable that you see happening from these contributions. And that's what I really like to see in terms of a partnership with our office, is really that you feel that you're part of the decision and not just, on the outside, on the periphery. So I think that there is definitely more power in this approach. We can pivot and turn with a lot more information in hand to make data-driven decisions, and that's what I really look forward to. So with that, I want to thank everyone for your patience with this process, and I hope that you have additional input to provide either through my email or through the MBQIP inbox. So thank you.
Awesome, thank you, Natalia. Any other quick questions for Natalia? Again, I want to make sure everyone knows that we will be collecting the chat box questions and comments and going through those TASC and Arquita and the federal office and getting that information, questions answered back to you guys. Awesome, thank you, Natalia, for those updates, as well as the follow-up discussion on the poolside chat.
Sure.
All right, Andrew, are you ready? We held them all because they're so excited for the reverse site visit updates and information about registration and what to do and how to do it.
Yeah, 1 second, Caleb. Let me open them up. All right, can you see that, Caleb?
We can.
Awesome. So, I'll turn the camera on. All right. All right. So the 2020 Flex Program virtual reverse site visit, that will be coming up in 2 weeks on August 4th through the 6th. And we're going to start each day at 11 a.m. Central Time. And so we encourage you all to go look at the agenda, like Tori said earlier in her update. It's really coming together, and it's a really good mix of different speakers and different topics, and it's really going to be great. And as it says here, the 2020 Flex Program virtual site visit is supported by the federal office and coordinated by TASC. And yeah, so the virtual event this year is going to focus on the importance of flexibility and adaptability in today's rapidly changing healthcare environment, and provide state flex programs with a collaborative learning environment to make connections, share best practices, and gather lessons learned to empower and support state flex programs and CAW flexibility. We're bummed that we can't meet in person today, but we're really looking forward to this virtual conference. So registration, a lot of people have registered already, and that's great. If you haven't already, please do by next Monday, July 27th. There's no registration fees or anything like that, but do know that it's not open to everyone. The intended audience is SOAR directors, flex coordinators, other key flex personnel, as well as partners. So if you have any questions about whether your staff falls in that category or not, just please reach out to your flex program officer. And then virtual logistics. So yeah, not in person, unfortunately, but we're really looking forward to how this is going to be. All sessions starting at 11 a.m. will be presented live, and they will be recorded and made available on the TASC website, as well as our portal. We're working with Perform Media, who's kind of an expert in putting on these kind of conferences online. You can see at the screenshot below that that's kind of what it's going to look like. And you will be given access, as long as you register on Thursday, July 30th. Can't see. Yep, Thursday, July 30th, you will be emailed basically a username and password to go into the portal, and you can start adjusting basically how you show up in the participant list, your bio, your credentials, everything like that. When you get in there, there won't be any content available because it's all live, but do be sure to sign in early and not wait till Tuesday, August 4th, just so you know how to get signed in. Other than that, we're really excited for how this conference is shaping up. It's been a really collaborative effort between us, FORP, all our partners, and our committee that we put together, and we're really excited. I see the chat box is still, I don't know.
Yeah, so Scott asked a question, Tracy answered that. One question, Andy, is how long will we go each day?
Yeah, I want to say it's 11 to 2:30 on Tuesday and Wednesday, and Thursday is, I think, about 15 minutes longer. And there's breaks in there kind of in between each session. I see asked about agenda. I can put the link into the agenda.
We can send that out to everyone as well.
Yeah, I don't have it on me. I did post these slides in the chat box as well, just in case you haven't registered, or you need to go check out the agenda. I see Tracy posted it. Thanks, Tracy.
Any other questions?
No other questions? How about pull up any questions?
All right, thank you everyone for attending and participating in the webinar. I think we had some really good discussion and chat box questions and things that'll be helpful for the federal office flex monitoring team with the new reports, as well as Arquita and TASC. Again, a reminder that we will download the chat box questions, separate comments and things, and excuse me, get an answer back to everyone. We'll do question answer things, send that out to everyone, as well as posted in the forum for those who are not able to attend today's webinar live. The recording will be posted as well as sent out shortly with the slides from today's presentation. Any other questions before we call it for the day? Please do take a moment to complete both polling questions. We review these and continue to make improvements to the webinars and educational offerings that we bring to you. This is a little bit of a different case because we had a bunch of updates that we needed to provide in a timely fashion, and we had a webinar on the books. A reminder that we have the virtual knowledge group webinar next week. The topic is health equity. So we want to hear from Flex coordinators what programs are going on in your state that you're either funding through Flex or supporting through Flex. Just want to initiate that conversation, have some initial conversations about that. Stratus Health will be helping us facilitate that conversation. If you had not had an opportunity or the time to respond with any programs or services that your Flex program is working on, please do send us an email or bring those for the discussion. Next week we will look forward to that conversation discussion. Sorry, I got distracted by the chat feed, the chat box. Wanted to make sure I scrolling down for the polling questions. All right, guys, short of that, I'd like to thank all of our partners, the federal office, Tori, as well as Natalia for updates, as well as the updates on the MBQIP reports. Sarah Brinkman from Arquita and Stratus Health, Megan Lahr from the Flex monitoring team, and Andy Naslin about the reverse site task. All right, guys, it is 3:30 on the nose. Thank you again for participating in the webinar. If you have any questions, please don't hesitate. Questions, comments, concerns, please don't hesitate to reach out to us at task@ruralcenter.org. We will see you next week for the virtual knowledge group call, and the week after that for the reverse site visit. We are all bummed that we weren't able to be there in person, but we'll still get to see each other this week. Thanks, guys. Have a good day, and we'll talk to you next time.
Thank you.